Welcome to this Introduction to Care Management in the Comprehensive Class Member Transition Program, provided by the UIC College of Nursing. This training will enable participants to define care management and the care management process, understand the roles and responsibilities of care managers, and effectively implement care management for Colbert and Williams class members. Care management processes are also defined in Policy P0.08, Care Management. Care management is defined as a person-centered, team-based approach to working with class members. The team includes the member, their family or caregiver, the care manager, and the member's medical and psychiatric providers. Care management aims to effectively integrate healthcare and social supports. Care management has been evolving since the early 1900s and is now a core component of chronic condition management. While the terms care coordination and care management have at times been used interchangeably, there are important differences between them. Care coordination is the process of identifying member needs, linking the member to appropriate services, and ensuring that the member's needs are communicated clearly to all other participants in the member's service plan. Care management, however, involves assessment, collaboration with other providers, working with social supports, as well as developing, implementing, and evaluating a comprehensive member-focused service plan. Care management involves intensive care coordination in addition to this broader set of tasks. Care management, when properly implemented, provides several benefits. First and foremost, members who receive effective care management report an increased quality of life. They are more likely to be safe and successful in the community. In addition, members more efficiently use community-based medical and psychiatric resources when they are working with a care manager. Care management can result in more stability and independence. Health and psychiatric well-being are promoted and functional needs are addressed. This leads to fewer hospitalizations, more manageable symptoms, and increased self-management abilities. Financial savings for the healthcare system as a whole, as well as for the member, can also occur through improvement of health and independence and reduced use of high-expense settings such as emergency departments, acute care, and long-term care. Within the Comprehensive Class Member Transition Program, care management has several specific goals. These include increased independence for members, enabling them to engage in more of the activities they enjoy. In addition, members will increase self-management through the support of a care manager. This includes self-management across domains, including medical, psychiatric, functional, and community needs. Effective care management will also result in fewer hospitalizations, a lower incidence of reinstitutionalization, and less utilization of emergency acute medical care, which will decrease costs for the member and for the healthcare system as a whole. Finally, care management will make the entire transition process more efficient and allow members to spend less time waiting on the transition process and more time enjoying and sustaining their independence in the community. The care management process has several interrelated aims. Care management supports members' participation in their own healthcare decisions and management. Care management also supports members' self-management of their chronic health conditions and their adherence to their prescribed medication regimens. Care management can enable members to better participate in health promotion and wellness activities. Care management also fosters increased collaboration among and between participants in the service plan, including the member, family and caregivers, medical and psychiatric providers, and the care manager. This facilitates better coordination between providers and continuity of care throughout the member's involvement in services. Effective care managers are constantly monitoring and evaluating the effectiveness of care plans as they are implemented and working to address and resolve barriers quickly. This rapid response to problems will enable members to have improved health conditions, increased satisfaction with services, and a better quality of life. Ultimately, well-planned care management results in members receiving cost-effective care in the least restrictive possible environment. The care manager wears many hats throughout the process of care delivery. The central process of care management, engagement, assessment, planning, implementation, monitoring, and evaluation, is the foundation of all of the care management activities. These care management activities include coaching, educating, and empowering, collaborating and coordinating, managing, documenting, advocating and negotiating, and facilitating and supporting. We will review each of these tasks shortly. The skilled care manager identifies member-specific needs and applies the applicable roles through the care management process. Just as the needs of class members evolve over time, the role of the care manager with a specific member evolves over time. It is vital that a care manager is skilled in each of these areas and applies them based on the member's needs. One of the primary activities of care management is ongoing assessment. This means to assess in the broadest possible terms the member's health status, their goals, strengths and risks, any barriers to care, unmet needs, and acknowledging the member's self-management abilities. All of the care manager's other roles and activities rest upon the foundation of solid, ongoing assessment. Care managers also develop, plan, and implement care plans. These care plans should be based on evidence-based guidelines, best practices, and standards of care, and include the input and participation of the member, family, caregivers, and other medical, psychiatric, and service providers. The care manager is responsible not just for building and planning the care, but also the implementation and monitoring of the plan elements. Care managers are responsible for coaching, teaching, and empowering as well. This includes building the skills, knowledge, and confidence of the member, their family, and the caregiving team. This teaching will build the abilities of the member and their supports to self-manage the member's health conditions, medication regimen, red flags and warning signs, and any other identified problems or risks. Ultimately, the care manager is responsible for increasing the member's level of independence with regards to all of their condition management skills, community engagement, and independent living skills. Care management is an inherently collaborative function. Care managers are responsible for coordinating the member's care plan with partners in other disciplines. Whether the care manager is a nurse, social worker, or other professional, they will be working with a broad spectrum of providers, including medical providers, pharmacists, nurses, social workers, facility staff, and home health providers, among others. Care managers must be able to effectively facilitate communication between different individuals and groups. This may include interpreting medical information for a member or their supports, helping a member communicate their symptoms or changes in status to a provider, and ensuring that providers from different disciplines have a shared understanding of the member's status and needs. In addition to collaboration, care managers must coordinate all the care the member is receiving. This includes the formal service providers and supports involved in the member's care plan, but also the informal supports, who may be providing services on an as-needed or intermittent basis. Ensuring that the member's care needs are met at all times becomes a significant part of the care manager's role. Care management is a supportive role as well. Care managers must support the member and their family, caregiver, and other supports in implementing the care plan. They also support the participants in reporting changes in status, including any new challenges or successes. Members also require support from their care manager when it comes to advocacy. Care managers help members by advocating for them and their families to receive the necessary services and the proper level of care. This may involve negotiating with others involved in the member's care plan. Members may require support or advocacy in negotiation with their providers or insurance plan in order to access the services they require. While care managers may conduct this negotiation independently, their role may also be to help the member develop negotiation skills so that they can advocate for themselves, thus increasing the member's independence. As the care plan is implemented, the care manager must continually monitor and evaluate it. This involves observing and tracking the effectiveness of the plan and adapting it as needed to accommodate changes in the member's life. Care plans should be revised based on ongoing evaluation to reflect changes in the member's health status, psychosocial needs, or self-management abilities. Care plans are a living document that should always reflect a current understanding of the member's situation. The care manager is responsible for maintaining effective documentation on every element of the care management process. This includes not just formal documents like assessments or the service plan, but the day-to-day logging of the activities the care manager completes. This is important for keeping track of the care manager's activities for funder requirements, but also serves as a way of ensuring that another care manager could pick up where the prior manager left off in the event the care manager is unavailable or the agency experiences a staffing change. The adage, if it's not documented, it didn't happen, definitely applies to care management. Finally, the management part of care management. The care manager is responsible for ensuring that transitions of care happen as smoothly as possible with minimal disruption to the member's health. This includes obvious transitions like the move from a nursing facility or SMRF to the community, but also covers smaller transitions such as introducing a new provider into the care plan or a change in the member's family that impacts the member's care. Care management follows a cyclical process. This process occurs within each contact as well as throughout the member's engagement in the program. The class member and the class member's support is always at the center of the care management process. In the relationship with the class member, the care manager begins by building engagement with the class member. This includes building rapport, helping the class member understand the care manager's role, and providing information about the program to the class member. The care manager then develops the care plan, which is subject to ongoing revision based on the changes in the class member's status. Next, the plan is implemented as the class member receives the services indicated in the plan. The care manager is monitoring and evaluating implementation while also maintaining engagement. While this diagram is depicted as a circle, multiple phases of the process occur simultaneously, and the overlap between phases is an integral part of the care management process. During the individual encounter, the care manager also engages in each of these steps, engaging the class member, evaluating the current status, adjusting plans, implementing plans, and evaluating outcomes. Just as care management is thought of as having multiple phases, engagement, assessment, planning, implementation, monitoring, and evaluation, the transition process in the comprehensive program is reflected in phases: assessment, pre-transition, transition, and post-transition, with the goal of smoothly transitioning class members between these phases without encountering barriers to transition or having information about the member be lost. The pre-transition phase can be thought of as encompassing all the activities that take place up until the class member's transition day. As of January 2025, Maximus conducts outreach and assessment for the comprehensive program. Prime agencies receive these completed assessments and referrals, which initiates their engagement with class members. After receiving the assessment and referral from Maximus, Prime agencies' care managers are responsible for synthesizing the information provided in the assessment in order to develop service planning goals. The service planning process is outlined in more detail in Orientation Module T3.1 Service Plan. Service planning is both a concrete task, that is, filling out the comprehensive service plan in the web app, but also an ongoing process. In addition, before transition, the care manager is responsible for ensuring that the member has all necessary documents to facilitate transition. This can include a state ID or driver's license, a social security card, a birth certificate, proof of naturalization, or other member-specific documents that might be necessary to secure housing and benefits. The care manager is also involved in coordinating additional assessments that may be necessary. These could include occupational therapy or UIC-ATU evaluations, nursing or integrated health assessments, neuropsychological testing, or agency mental health assessments. The housing search phase of pre-transition activities can be lengthy, especially for members who have legal or financial barriers to securing housing, such as poor credit or a criminal history. However, for some members, locating housing is a smooth and speedy process. Discussions with facility staff and providers should occur on an ongoing basis. When the member is approaching discharge from the facility, a formal discharge meeting is scheduled with the nursing facility or SMART staff, the member, and other supports and providers. The purpose of this meeting is to review the member's plan and to identify additional needs that will need to be addressed prior to transition, ensure that all necessary tasks have been completed, and to assign accountabilities to specific individuals regarding tasks that still need to be completed. For some members, multiple discharge meetings may be necessary to address complex situations. The transition day itself concludes the pre-transition phase. This involves ensuring the member leaves the facility with all of their medications and medical supplies, that any in-home supports are established, the member is aware of appointments and how they will get there, and that the member has enough food and supplies to support them for at least the first few weeks they are in their home. Depending on the member's needs and agency protocols, transition day tasks may also include taking the member to Social Security to report their discharge from the facility, or arranging initial visits with the nursing staff or other providers. Now let's explore how the central processes of care management discussed earlier overlay with the comprehensive class member transition program phases. The prime agency's role in the care management process begins with engagement. The purpose of engagement is to develop and maintain a relationship with the class member. This also includes connecting with the class member's guardian, if they have one, as well as their family or other social supports. A key action within this stage is to obtain effective informed consent. Obtaining informed consent is a crucial element of beginning engagement with the class member. Along with obtaining informed consent, engagement involves connecting with the class members, other providers, and supports. And this requires the class member to complete and sign releases of information for these individuals and organizations. Engagement with class members, guardians, family, supports, and providers continues throughout the class member's progression through the program. Continued engagement is essential to maintain relationships and essential to progressing towards the goals of treatment, skill development, and community integration. Engagement is ongoing, as is information gathering. In addition to ongoing conversations with the class member, their guardian or family, and other supports, additional information is gained from nursing facility or SMRF records, as well as conversations with other healthcare providers or reviewing other records. Information may also be gained through formal assessments conducted by the prime agency and may include the IMCANs, occupational therapy, and nursing assessments. Information gathered should be clearly documented within notes. This should include both subjective, what is reported, and objective, what is observed information. Planning is a key part of the care management process. This includes the formal, comprehensive service plan, as well as regular and ongoing updates. Planning may also include action plans, which are plans to address immediate concerns that do not need to be sustained long-term. Service plans take the information captured in the initial and ongoing assessments and builds on the class members' needs, strengths, challenges, and barriers. The plan should work towards the class members' goals using available resources in the community. The care manager should ensure that the plan covers all the domains of the class members' needs. It should also reflect a prioritization of needs. The most pressing items should be identified as being addressed first. Effective service plans involve other people beyond the member and the care manager. This includes the member's family or other supports, the agency's interdisciplinary team, other providers, facility staff, etc. They should also incorporate evidence-based guidelines and best practices based on the member's needs. Finally, service plans should not just focus on the specific services available within a particular agency, but should incorporate other resources available in the community if those are the best options for addressing a member's needs. Action plans are developed as needed to address immediate needs and may be reflected in case notes. For example, a member may express concerns about their current blood pressure reading and a headache. While ongoing monitoring, skill development, and collaboration may be included in the service plan, the immediate action plan documented may include items such as reviewing the log, calling the provider, and/or escorting the class member to the hospital if indicated. From the first day the member is engaged by the care manager, they should have an understanding of how the transition process will be implemented. Care management staff should always ensure that the member understands the next steps in the process and how these steps relate to the member's goals. Care managers provide ongoing and regular contact based on the member's needs. At times, this may involve more frequent contact. The implementation of a service plan also relies on the involvement of the member's formal or informal supports. This includes other providers as well as family and social supports. Implementing the service plan requires the care manager to ensure that the member's medications and supplies are obtained in sufficient quantity to prevent missed doses or other problems with adherence. The member should also clearly understand the service plan and all of its components, the medication list, the upcoming appointments, the service plan document overall, and the member's 24-hour backup plan. Throughout the process, the member should know what happens next and how that relates to the member's short-term and long-term goals. Once the initial service plan has been developed and the class member works their way towards transition, the care manager must continue to engage with the class member based on the class member's needs, as well as the requirements of the comprehensive program. During this continued engagement, the care manager is checking in about how effectively the service plan is being implemented, and if there are areas where the plan should be adjusted to better serve the class member. If the plan needs to be adjusted, it should be, even if the mandatory time frame for a service plan update hasn't been reached. Things the care manager should be constantly monitoring and evaluating: the class member's safety and any urgent needs or red flag symptoms. This includes making sure the class member is continually aware of how to identify those urgent needs or red flags and communicate them to their providers. The care manager also checks on the class member's level of engagement with the program, with the community, and with their familial and social supports. Monitoring the class member's health and their healthcare utilization is also important. Has the class member gone to their appointments? Have they had any unexpected hospitalizations or other incidents? The member's functional status and ability to self-manage their conditions changes naturally over time. Whether the member's abilities are improving or declining, these changes may necessitate modifications to the care plan. The care manager must not overlook the member's satisfaction with their transition. If the member is unhappy, this may indicate unmet needs. The member's progress towards goals is also important. This includes both the member's perception of their progress as well as the care manager's observation of their achievement. Monitoring also involves keeping track of what has and hasn't worked for the member. If there are interventions that have worked particularly well for the member, it may be important to utilize them more heavily. Similarly, if some interventions have not been effective for the member, the care manager should consider de-emphasizing them in the care plan. Also, care managers should note and attempt to address areas where additional resources may be required. This process often involves some creative thinking and planning in order to overcome resource deficiencies. Where does the care manager get the information they need to effectively evaluate the implementation of the plan? There are a plethora of resources available to learn about the member's progress towards their goals. These include the care manager's direct observations, information shared by the member or by their supports, communication within and between staff and teams at an agency, the member's healthcare and other service providers, an agency's partnering or subcontracting agency, and comprehensive program resources like UIC, ATU, and the College of Nursing. All of this effective monitoring and evaluation means very little if it is not effectively documented. The care manager must ensure that their documentation is accurate, current, and clear. This includes case notes or progress notes reflecting actions the care manager has taken, contact information for the member, providers, and supports, medications and diagnosis, clearly documenting any changes in status or reportable incidents, and making sure that the plan of care document itself is clear and complete. In the comprehensive program post-transition phase, the care manager must make sure that the service plan is effectively implemented. This includes both the tasks the care manager is responsible for themselves, but also the other plan's participants' accountabilities. This must be monitored consistently during in-person and phone contacts throughout the 18-month post-transition monitoring period. As the member's goals and needs change, so should the service plan. As a reminder, the service plan must be updated every 180 days that can be modified sooner if the need arises. Monitoring the plan also includes clearly documenting all of the information gleaned about the service plan's implementation and its effectiveness. As discussed, the comprehensive program post-transition monitoring period is 18 months. However, members are able to remain engaged with their provider for as long as they meet agency eligibility requirements, even though comprehensive program monitoring is no longer necessary. If care management is terminated at the end of 18 months, it should be planned for just as any other service would be. The member needs to know that this is coming well in advance, and this should be communicated through a formal termination meeting with the member at the end of that 18-month period. If the member requires additional supports to be in place, the care manager must ensure that there is an effective plan in place to initiate or maintain those services. Ideally, the member has developed the independence and self-management skills during the prior 18 months to be able to meet their own needs moving forward with minimal support. The care manager can effectively set the member up for success in this endeavor by properly planning for termination. Termination of care management service any time prior to 18 months should be communicated to and coordinated with the class member's assigned quality monitor and UIC College of Nursing. Care management is especially crucial during transitions in care. The most obvious transition in the comprehensive program is the member's transition from the nursing facility or SMRF care to their community housing. However, transitions in care also include returning to a facility or treatment program, as well as hospitalizations and discharges or changes in caregivers. During these transitional periods, class members are at increased risk. Transitions may also result in increased stress and distress. This can manifest as increased medical or psychiatric instability or symptom presentation, adherence issues like missing medications or appointments, and may result in a change in the services the member requires. Transitions in care require the care manager to be vigilant in providing timely and consistent follow-up, both with the member and with their providers, as well as ensuring that information is effectively communicated between all parties involved. Typically, transitions in care also require an adjustment to the member's care plan, as their service and care requirements have probably changed. There are several additional considerations with regards to care management that must be considered in the context of the comprehensive program. Firstly, information handoffs. In many agencies, class members work with different staff or teams at different stages in the process. Every time a new staff person takes over the class member's care, there is the potential for valuable information to be lost. Effective care management minimizes the number of handoffs between staff or teams, and ideally has a single person responsible for following the class member through their engagement in the comprehensive program. If that is not possible, ensuring that information is shared in both written and verbal forms when handoffs occur is crucial, and providing overlap between staff's involvement whenever possible also helps. Care managers must be able to effectively collaborate within their agency across disciplines and with other providers. This requires effective communication skills and an understanding of the various roles of their professional colleagues. Care managers must balance the need for accurate and complete information with the class member's right to privacy and self-determination. It is important to verify the class member understands the purpose of the care manager's actions. If a class member resists involvement, the care manager should reflect on why this is occurring and make changes if needed. Care management must always be delivered in the member's preferred language. If this is not possible with multilingual staff, agencies must incorporate interpreter services. While family and friends can provide informal interpretive services, they can be unreliable or inaccurate translators, especially around sensitive topics or with uncommon medical terms. Care managers should ensure that the class member is being communicated with effectively. For some members, this may involve nonverbal communication, such as picture books or written materials. Work with the member to ensure their needs are being addressed effectively. This ties in with cultural competency, which is a vital part of care management and service delivery. Care managers must take it upon themselves to understand the member's culture, as well as their own cultural biases and expectations, to ensure that members' care is not negatively impacted by implicit or explicit biases. Agencies should incorporate cultural competency into their staff training and professional development programs. Care managers may also encounter situations which involve ethical dilemmas or boundary crossings or violations with members. It is important that care managers are trained on ethics and boundaries and have agency support in handling these situations. Care managers must also know and abide by the code of ethics of their profession and agency, as well as applicable laws, rules, and guidelines. Informed consent is the topic of another training, but it is crucial to ensure throughout the process that the member understands what is happening and what they are agreeing to. If a care manager is uncertain if a member can effectively understand what they are providing consent to, they should take steps to ensure that the member does understand before they proceed. Finally, agencies must have plans in place for crisis intervention as well as clinical supervision. Care managers must have support from their agencies with regards to professional growth and support, as well as backup for addressing clinical issues that arise in the course of their work. As crises occur, the care manager must also have a firm understanding of what steps they should take to address the situation, including what other agency staff must be involved when clinical crises occur. While care management is a complicated process, especially when working with class members who have complex needs involving chronic conditions, there are strategies that can ensure that it is as effective as possible. Early and consistent contact by the care manager is a key component in fostering successful care management. Frequent face-to-face contact is important in building and maintaining engagement and rapport between the class member and their care manager. While phone and video contacts are helpful and an important tool for engagement and monitoring, face-to-face contact provides additional information that may not be able to be obtained remotely. Evidence-based practice is also crucial. There is a wealth of scholarship regarding best practices for complex care management. Incorporating the strategies that have been shown to be most effective with the populations we work with will increase the likelihood that these strategies are effective. Service plans also should not be static or fixed documents. They should be living, breathing creations that are continually adapted to the class members' changing needs. Care managers are at their most effective when they have a strong grasp of the resources available in the member's community. This can be aided on an agency level by developing resource guides, and individual care managers will benefit from building relationships with commonly used resources. Realistic goals are important in ensuring that members maintain motivation and engagement. If the care manager or member are unrealistic in their expectations, the member may become demoralized or lose their sense of self-efficacy. The most effective plans have goals that the member finds attainable. Early and consistent care manager assignment is a key feature of the comprehensive program. The care manager should become involved as early in the process as possible, ideally at the beginning of the member's involvement in the program. And then the same person should follow the member through the entire process. While not every agency has structured their program this way, this level of consistency should be maintained as much as possible. The care management team is a valuable resource for care managers. By working in a team, care managers can collaboratively develop relationships with resources and share those resources with one another. In addition, having multiple eyes on a particular situation allows care managers to troubleshoot challenges more effectively in a team. Care managers in a team can also provide support to one another during challenging situations or crises, as well as celebrate successes as members move through the transition process. The care management team is the foundation of success for your staff, as well as the member you work with. The content in this presentation includes material based on scholarly research in the field of care management. For more information, please review the references listed here. Current versions of all comprehensive program policies and forms can be found in the web app library, and educational resources can be found on the Colbert-Williams training website, managed by the UIC College of Nursing. Any questions can be directed to the Colbert-Williams Help Desk, linked at the bottom of every page of the Colbert-Williams training website. Thank you for your attention and efforts to ensure safe and successful class member transitions.